I'm delighted to be able to be with you and to talk some about some of the crisis in our healthcare system. The question has been asked about the high-risk pools, which are a part of the Affordable Care Act that was passed in 2010. And the problem is that it really doesn't meet the need, because the high-risk pools are being underutilized because most people really can't afford the amount of money you need to buy those premiums. And really the problem is that we shouldn't have a high-risk pool. We should have an everybody in, nobody out pool. So all of us are together and no one has to bear the burden of paying for the sickest people on their own, but we share that together so that when we're healthy, our money helps the others, and when we are sick, their money helps us. And that's what single-payer healthcare will do, HR 676.
Right. I mean, it's a fundamental point that if we want to get a universal, affordable, guaranteed health care in the United States, we cannot do that using a private insurance model, because private insurance is designed to create a profit for their shareholders, and they do that by avoiding the sick and by avoiding paying for care, or making it complicated for us to get reimbursed for the care that we received as patients or as health professionals. And that's as long as you have that kind of incentive, what we've seen is that even when we try to get health insurance companies to cover people who actually need care, they find ways to skirt the rules that are written. So if, say that you force an insurance company to take people with pre-existing conditions, well, what they'll do is they'll restrict their networks. So if there's a particular center in the community that provides a specialty form of care for people with a certain condition, the insurance company may not cover providers at that center, so that people who have those conditions won't buy their insurance because they wouldn't be able to get the care they need. So that's a back-end way of dealing with this. There are other things that the health insurance companies do, like there's a provision that they can't turn people away, that if somebody applies for a policy, they're not allowed to deny them a policy. They'll write them a policy. It may be $30,000 a year for the premium, so they've given that person the option of buying their insurance, but it's not affordable. So in reality, the person still isn't getting care. So that's what we're talking about with a universal publicly financed system. It takes the profit motive away, and that's the key, that our system is now built around health and around promoting everyone's health, and each one of us, we never know when we're going to fall into a situation where we need health care. It can happen to any of us if we have an accident or someone has a heart attack or finds out that they have cancer. And so the beauty is taking away so that we no longer pay for care based on the severity of our illness. We all pay equally as we are able into a system that's there to meet the needs of each of us when we need it.
And under the Affordable Care Act, healthcare is not going to be affordable.
It's like the Clean Air Act or the Healthy Forest Act. It didn't really add cost
controls. It's really not going to be affordable, and it's not going to be equal. So we're heading down a path that's already started, where even those who have insurance don't have insurance that's adequate to cover the disease that they need treatment for. With the co-pays and deductibles rising so much, more and more of us are becoming underinsured. And that's the direction we're headed. When what we have to do is take away the financial barriers that keep people from getting the care that they need. And that's what HR 676, the Expanded and Improved Medicare for All bill, does. It says no co-pays and no deductibles, and we're all covered, and we don't fall out of the system when we lose our jobs or we change jobs or when we hit a certain age. And so it's a way to have a seamless plan that really is humane and is not based on the profit. And that's the problem with our system now. Our nation spends about $8,000 annually per person for health care. And the rest of the industrialized countries spend about $4,000 or less. and yet they have greater longevity, they live longer, they have greater rates for, lesser rates for maternal mortality or infant mortality. They do a better job at preventive care. You know, it's not that we don't have the money, we just don't have a system of health care that uses the money for care, and the money is going down the drain to those big corporate CEOs and their profits and all of the things that they put into the system to make it possible to make it profitable.
Yeah, one very specific concern I have with the high-risk pools is you have to be uninsured for 6 months before you can even qualify. But what happens if you have a very serious condition? You can't wait 6 months to get care, and that's what Kay was bringing up about the HR 676, Expanded and Improved Medicare for All. There are no cracks or gaps. From the time that you're born until the time you die, you're covered. You have true health security. The United States is the only industrialized nation where people go bankrupt because of illness or medical costs. And in Massachusetts, where they have a state-based version of the Affordable Care Act, the number of bankruptcies, personal bankruptcies due to medical illness and costs, medical costs, has continued to rise. The proportion of people in the state of Massachusetts that say that they still can't afford health care because of these financial barriers of co-pays and deductibles is higher than it was before the act was passed. That's what we've done at the national level, and that's why we must continue to fight for HR 676, for a national universal guaranteed, truly affordable, because it's proven to control our healthcare costs around the world and with our own Medicare system here in the United States. That's the kind of system we advocate for.
Can you speak to the prescription drug aspect of HR 676 for everyone who has that problem of affording their prescription drugs?
Absolutely, because HR 676, the benefits that are included in HR 676 are comprehensive, including prescription drugs, dental care, which is really needed in the U.S., vision care is very needed, mental health treatment is very important, preventative care, all of these things. The HR 676 also does something that none of the other healthcare bills can do. By creating a single system, we can now negotiate for fair prices for our pharmaceuticals, because every other industrialized nation does that. Since we don't do it here, the pharmaceutical companies are charging 3 times or more what they can get away with in other nations. I was just in Maine, and there's a family where one of the members needs medication for their asthma. They can't afford it, so they're buying it from Canada, where it's a third of the price. So this, not only are the benefits included for every single person, but we can bring the cost of those medications down.
And does that also include supplies, the medical supplies?
It includes durable medical equipment. It includes things like therapy, rehabilitation, long-term care. It's really comprehensive, because the way that we use our healthcare dollars to actually pay for healthcare is by not having this really complicated bureaucratic process that we have right now with all these different private insurances. It's really simple. We pay through our taxes up front for our care. When we need it, we go and get our care, and that's paid directly to the healthcare providers. So if we had to have extra insurances, that makes it more complicated. Making it comprehensive and universal is the most efficient way to go.
And even nursing home care, long-term care, and home health, physical therapy, all of those things are covered as well. So it's really in the interest of everyone. You know, now people on Medicare are having trouble with drugs. Well, this would cover them and help them. And there are gaps, you know. People have to pay quite a bit to get gap insurance. Well, we wouldn't have that. That would be gone. The 18 to 64, that group of people would be covered totally. You know, now in Kentucky, 32% of that group, 18 to 64, has no insurance. That's just huge, you know. We really have to do something about this to make sure that everybody is covered. And for children, we could make it comprehensive and give them the dental care. You know, let's let them grow up with their teeth and their eyes and everything. Every opportunity to have a better life for all of us. And you know, it's like education. We all live in a better society because we have public education, and we say everybody's child should learn and have a chance for that education, and that makes the society better. And it's that way for healthcare. When all of us have it, we live in a more humane and a more prosperous and a better world.
That's a really important point, because not only does having HR 676 or Improve Medicare for All help create a healthier society, in the United States, because we tie healthcare to employment, people are afraid to leave jobs that they don't like. People are afraid to start their own businesses because they might lose their health benefits. Taking healthcare out of the picture for labor, for businesses, frees them up so that labor can now negotiate for other things like worker safety or better pay, or those types of things. Businesses, people can be free to open their own small businesses or go back to school or do the things that they want to do. We're squandering the talent in this country by tying people into these jobs for their healthcare benefits.
And can you speak to how HR 676 can eradicate the medical provider fraud that you see going on, where the people who provide whatever medical care you need will then double charge whomever it is they have to go to get their monies? I mean, it seems like it's quite obvious, but for some people out there, they'll still ask that question. That's like, those who are so conservative, who don't want to cover everybody because it's on their back, they'll want to know, well, how can you stem that tide or totally eradicate something like that from ever happening?
Well, one of the things that HR 676 does is take the profit out of it. If you're a for-profit hospital, that means you're taking a part of the money for care and putting it into the pockets of wealthy stockholders. And we're going to take that out. We want that our health care money to go to the care. The people who actually give care or are important to that process should be paid well. But we don't need insurance companies in there. We don't need those CEOs to do that. So it will take that profit making out of it. There will be a global budget for the hospitals so that we won't have to charge every gauze pad. But we'll have a way to globally budget for what is needed for that community that is served. And our government, publicly owned, will control the purse strings. So we will allocate what we want, and we will try to make it as sane and honest and fraud-free as we can possibly make it, and we'll do much better than these for-profit insurance companies.
Yeah, because it is a lot of times it's the for-profit groups that are trying to commit fraud on the system to get more money. And by having a publicly transparent and accountable system, you can see where the money's going, and it's much simpler. So it's a lot easier to see where that money is going. Right now it is so complicated, and the private insurance companies don't even want to give us the information. We pass laws in the state of Maryland, where I'm from, requiring certain information from the insurance companies, and then we have to still fight with them to give us the information that by law they're supposed to give us. So that goes away under a publicly accountable and transparent healthcare system.
Thank you so very much. Unless there was anything else you wanted to add that you can just think off the top of your head that I didn't think to ask, then we're done. If
we could just give a final plug, because this is really important. The healthcare crisis in this country continues. People are suffering and dying every day. We're already spending enough money in this country to provide high-quality, lifelong, comprehensive health care to everyone. We don't talk about the health injustice in this country enough because we don't see that compared to other nations. The things that happen here don't happen there. People don't lose their homes in other countries because they get sick. So this is really a matter of social justice and what's right. And I hope that people will get inspired and get involved, and let's please fight, because we can make this happen. The people can make change in this country, and the sooner we do it, the better off we're going to be.
Thank you very much. Thank you so very much.
Thank you.